The gastrointestinal tract is comprised of the body's organs responsible for digesting the food you eat, converting it to fuel, and removing the waste. The lower gastrointestinal tract is made up of the large intestine, which is also called the large bowel or colon. It begins at an area called the cecum and ends at the anus. The colon is a tube about 2.5 inches wide. Stretched out, it would measure 4 to 5 feet long. As you can see, however, the colon isn't straight. There are several bends and turns between the cecum and the anus. Your physician will perform a colonoscopy to examine the inner lining of the colon. The instrument he or she will use is called a colonoscope. It is a flexible tube, slightly narrower than a garden hose, and about 5 feet long. One end has a lens in it, and the other end an eyepiece and controls. The controls allow the physician to move the tip of the scope in any direction. The inside of the colonoscope contains several small channels for air, for suctioning, for instruments, and for the fiber optic transmission of light and pictures. The pictures can be seen in the eyepiece at the end of the scope, or on a television screen in the examining room. A colonoscopic examination is performed to investigate the cause of any of several symptoms. These include obvious rectal bleeding, occult or hidden blood in the stool, or a recent change in bowel habits, such as persistent constipation or diarrhea. Colonoscopy is also used to evaluate abnormalities which have shown up on other tests, such as a barium enema, and for periodic checkups of patients who have a previous history of colon cancer or polyps. The most common cause of occult bleeding is the presence of polyps, which are abnormal tissue growths on the inside lining of the intestine. Polyps are usually benign, but some are considered a precancerous condition. That means undetected and untreated polyps sometimes develop into colon cancer. But before you get too concerned, the development of cancer is exceedingly rare. When it does happen, especially when detected and treated early, it is often curable. As polyps are the most common abnormalities found during colonoscopic examinations. Others include colitis, which is an inflammation of the lining of the colon, tumors, diverticulosis, or the development of pouches or pockets in the wall of the large intestine, vascular malformations, which are abnormal clusters of small blood vessels just under the inner lining which can open up and bleed, rarely ulcers in the colon or rectal area, and hemorrhoids. The colonoscopy will be performed in the doctor's office or in a special room at the hospital, where you will be asked to lie on your left side on an examining table. You will be given intravenous medication to sedate you, and that means you will be almost completely asleep when the procedure is done. Many people, in fact, don't remember very much about the procedure after it's over. The doctor will slowly and gently insert the lubricated end of the colonoscope through the anal opening into the lower part of the large intestine. The tube is then advanced slowly through the anus and into the colon. The controls on the colonoscope permit the tube to be steered so that when each turn or loop is encountered, the tip of the scope can be maneuvered through it. Sometimes, to make the passage of the tube easier and to help the doctor examine certain parts of the colonic lining, air is pumped through the tube into the colon. The air expands the colon and makes the lining easier to see. The air sometimes causes cramps, like gas pains, but the amount of air is controlled by the doctor, and it can be reduced if you become uncomfortable. This is a view of what the doctor sees through the colonoscope. Because the colon expands and contracts in length, it is not usually necessary to insert the full 5 feet. The amount inserted will be sufficient for examination of the entire colon, from anus to cecum, and on occasion into the lower end of the small intestine as well. The entire examination will take about 30 minutes. If abnormalities are found, an instrument can be inserted through a channel in the colonoscope so that a biopsy or tissue sample can be removed for later laboratory analysis. There is no sensation inside the colon, so when tissue is removed, you will not feel it. If polyps are found, a special instrument can be inserted into the colonoscope and the polyps can be removed. Prior to the development of the colonoscope, only the largest polyps were removed, and they had to be taken out surgically. In preparation for your colonoscopy, your doctor will ask you to consume only clear liquids for 24 to 48 hours prior to the procedure. You may also be asked to take laxatives, enemas, or large quantities of special fluids by mouth to clean out your digestive system. Your physician will discuss these preparations with you in detail. You should tell the doctor about any medications, especially blood-thinning medicines, you are taking. Make sure he or she is aware of any allergies you have to drugs or other substances. And since you may be drowsy after the procedure, bring someone with you to help you get home. It takes most patients about an hour to recover from the sedation, and they usually go right home. Patients return to a regular diet immediately. The only expected after effects of the procedure are excess gas and cramping, which should resolve over a few hours, and you may have irregular bowel movements for 1 or 2 days. Thousands of endoscopic exams are performed every year, and it is a very safe procedure. Still, there are some risks you should know about. These include a reaction to the intravenous medication, excessive bleeding at the site of a biopsy or polyp removal, and a tear or perforation in the colon itself. All of these risks are extremely rare. In fact, colonoscopy is one of the safest medical procedures you can have. Please remember, if you have questions before or after the procedure, the answers are available. Just call your doctor and ask.
What I remember from when they removed the polyp at the time was that I had a very relaxed feeling about me, but I felt no pain, so I wasn't exactly sure when it happened, but I was very relaxed.
What I remember about the procedure is that I was wheeled into a room. There was the doctor was there. There was a nurse. The doctor was very comforting in talking to me. I was not frightened. And I remember that I was dozing on and off throughout the procedure, and at a certain point I obviously fell asleep because I don't remember very much beyond that.
So the minute that I left the hospital, I went home and chowed down on several large sandwiches, some soup, and some ice cream. As I recall, there was no problem with eating following the procedure.